Dengue fever and malaria are serious health concerns worldwide. They affect millions every year, mainly in tropical and subtropical regions. Dengue fever is caused by a virus transmitted through Aedes mosquitoes. Malaria is caused by a parasite called Plasmodium, transmitted by Anopheles mosquitoes. Early diagnosis and prompt treatment are vital to prevent complications and reduce mortality. Dengue and malaria are spread through the bites of infected mosquitoes. These mosquitoes thrive in warm, humid climates and breed in stagnant water. The Aedes mosquito, responsible for dengue transmission, is active during the daytime, while the Anopheles mosquito, which spreads malaria, typically bites at night. Understanding the breeding habits of these mosquitoes is crucial for effective prevention. The Aedes mosquito can breed in small water collections, such as flower pots, discarded tires, and even bottle caps. The Anopheles mosquito prefers larger water bodies like ponds, marshes, and rice fields. Climate change is a growing concern as it expands the geographical distribution of these mosquitoes, increasing the risk of dengue and malaria in new regions. Warmer temperatures and changes in rainfall patterns create more favorable conditions for mosquito breeding and survival. Therefore, it is essential to implement comprehensive mosquito control measures, including eliminating breeding sites, using insecticides, and personal protection methods like mosquito nets and repellents. Dengue fever typically presents with a sudden onset of high fever, often reaching 104 degrees Fahrenheit or higher. This intense fever is often accompanied by severe headaches, pain behind the eyes, muscle and joint pain, nausea, vomiting, and fatigue. A characteristic skin rash resembling measles usually appears 2 to 5 days after the onset of fever. Other warning signs include persistent vomiting, abdominal pain, bleeding gums, and difficulty breathing. Diagnosing dengue fever involves a physical examination and a blood test. Doctors look for typical symptoms and check for a history of mosquito bites. The blood test confirms the presence of the dengue virus or antibodies produced by the body in response to the infection. Early diagnosis is crucial to ensure prompt treatment and prevent complications. If you experience any symptoms of dengue fever, especially after traveling to or living in a dengue endemic area, seek immediate medical attention. Malaria symptoms typically appear 10 to 15 days after the bite of an infected mosquito. Initial symptoms resemble the flu: fever, chills, sweating, headache, muscle aches, fatigue, and nausea. As the infection progresses, cyclical patterns of fever, chills, and sweating may emerge. Diagnosing malaria involves a physical examination and laboratory tests. Microscopic examination of blood smears remains the gold standard for diagnosis. Early and accurate diagnosis is crucial for effective malaria treatment. Section 5. Treating dengue, managing the fever. There is no specific antiviral medication to treat dengue fever. Management primarily focuses on relieving symptoms and supporting the body's natural healing process. Rest is crucial, allowing the body to fight off the virus. Doctors recommend over-the-counter pain relievers like paracetamol or acetaminophen to reduce fever and alleviate pain. Avoid aspirin or ibuprofen, as they can increase the risk of bleeding complications associated with dengue fever. Staying hydrated is essential. Drink plenty of fluids such as water, oral rehydration solutions, or fruit juices to prevent dehydration caused by fever and vomiting. In severe cases, hospitalization may be necessary to provide intravenous fluids and electrolytes, monitor for complications, and provide supportive care. Close monitoring for warning signs like persistent vomiting, abdominal pain, bleeding, or difficulty breathing is crucial. If any of these symptoms develop, seek immediate medical attention. Section 6. Treating malaria, battling the parasite. Malaria treatment involves anti-malarial medications that target the Plasmodium parasite. The choice of medication depends on the parasite species and drug resistance patterns. Effective drugs include artemisinin-based combination therapies or ACTs. Other drugs like chloroquine and mefloquine may be used based on susceptibility. Severe malaria requires immediate hospitalization and intensive care. Intravenous antimalarial medications and supportive care are crucial. Early diagnosis and prompt treatment prevent severe malaria and reduce mortality. Section 7. Preventing mosquito bites, your first line of defense. Preventing mosquito bites is the most effective way to protect yourself from dengue and malaria. Mosquitoes are most active during dawn and dusk, so take extra precautions during these times. Wear long-sleeved shirts, long pants, socks, and shoes when outdoors. especially in mosquito-prone areas. Light-colored clothing is less attractive to mosquitoes. Apply mosquito repellent containing DEET picaridin or IR 3535 to exposed skin and clothing. Follow the instructions on the product label carefully. Use mosquito nets, preferably treated with insecticide, over beds and sleeping areas, especially for children and pregnant women. When staying in accommodations without air conditioning, ensure windows and doors have screens to prevent mosquitoes from entering. If screens are damaged, repair them promptly, or use mosquito nets over windows and doors. Section 8. Eliminating breeding grounds, community action. Controlling mosquito populations is crucial in the fight against dengue and malaria. Communities play a vital role in eliminating mosquito breeding sites and reducing the risk of disease transmission. Remove or empty any standing water sources around homes and communities. These include discarded tires, buckets, flower pots, clogged gutters, and any containers that can collect rainwater. Change water in pet dishes, bird baths, and vases at least twice a week to prevent mosquito larvae from developing. Keep swimming pools clean and chlorinated, or cover them when not in use. Support local vector control programs and initiatives aimed at reducing mosquito populations. This may include insecticide spraying, larval control measures, and community education campaigns. Report any unusual mosquito activity or potential breeding sites to local health authorities for prompt action. Section 9. Raising awareness. Knowledge is power. Raising awareness about dengue and malaria is crucial for prevention, early detection, and prompt treatment. Educating communities about the diseases, their transmission, symptoms, and prevention methods empowers individuals to protect themselves and their families. Public health campaigns, community outreach programs, and school-based education initiatives can effectively disseminate information about dengue and malaria. Utilize various communication channels including television, radio, social media, posters, and pamphlets to reach a wider audience. Emphasize the importance of seeking prompt medical attention if dengue or malaria is suspected. Delay in diagnosis and treatment can lead to severe complications and increase the risk of mortality. Encourage communities to adopt preventive measures, such as eliminating mosquito breeding sites, using mosquito repellents, and wearing protective clothing. Promote collaboration between healthcare providers, public health officials, and communities to strengthen surveillance systems, improve disease reporting, and implement effective control measures. Section 10. Early detection, the key to successful treatment. Early detection of dengue and malaria is crucial for successful treatment and better health outcomes. Recognizing the symptoms early and seeking prompt medical attention can significantly improve the chances of recovery. Be aware of the common symptoms of dengue fever, such as high fever, severe headache, muscle and joint pain, rash, nausea, and vomiting. Similarly, recognize the typical malaria symptoms, including fever, chills, sweating, headache, muscle aches, fatigue, and nausea. If you experience any of these symptoms, especially after traveling to or living in a dengue or malaria endemic area, consult a doctor immediately. Early diagnosis allows for timely initiation of appropriate treatment and prevents the progression to severe disease. Remember, early detection is particularly critical for vulnerable populations such as young children, pregnant women, older adults, and individuals with weakened immune systems, as they are at higher risk for severe complications. Section 11. The importance of prompt medical care. Prompt medical care is essential for managing dengue and malaria effectively and preventing severe complications. Seeking medical attention immediately after experiencing symptoms can be life-saving. Doctors can accurately diagnose the disease through physical examination, medical history, and laboratory tests. Early diagnosis allows for appropriate treatment with anti-malarial medications for malaria and supportive care for dengue fever. Timely medical intervention helps manage symptoms, prevent dehydration, and monitor for potential complications. In severe cases, hospitalization may be necessary to provide intravenous fluids, medications, and other supportive care. Delaying medical care can lead to severe complications, such as dengue hemorrhagic fever, dengue shock syndrome, cerebral malaria, organ failure, and even death. Remember, early diagnosis and prompt medical care are crucial for improving outcomes and reducing the burden of dengue and malaria worldwide.